Have you ever picked up a prescription and seen that little sticker? The one that warns you not to eat grapefruit? It feels so random. Kind of weird, right? Well, today we're going to crack the code behind that very specific warning. Okay, let's get into it. So, what is the deal? It really does sound like the beginning of a strange riddle. But the answer, it turns out, reveals this absolutely fascinating and super important process that's happening inside your body every single day. All right, to solve this mystery, we need to take a trip. We're going deep inside your liver, which you can basically think of as your body's main processing plant for pretty much everything you take in. Now, at the heart of this whole operation is a group of enzymes with a bit of a technical name, Cytochrome P450. We just call it CYP450 for short. Think of these guys as the essential workers on the factory floor. Their main gig? To break down medications so your body can use them, and then, get rid of what's left. So, picture this, a huge factory running 24/7. Drugs arrive on a conveyor belt. The CYP450 workers process them, and then they're sent on their way. The speed of this whole assembly line is absolutely crucial. But what happens when something or someone comes along and throws a wrench in the works? Well, first up, let's meet one type of factory sabotager, the accelerators. In the medical world, we call these inducers, and they don't just speed things up a little bit, they crank the whole factory into hyperdrive. And here's why. That extra speed is such a big problem. When that factory line is running way too fast, it breaks down a drug before it even gets a chance to do its job. So what's the result? The amount of active medication in your bloodstream just plummets, and that can make it completely ineffective. So how in the world do doctors and pharmacists keep track of all the things that hit the accelerator? Well, they use a secret code, a surprisingly memorable mnemonic, CRAPGPS. I know, it's not glamorous, but trust me, it's a lifesaver. Let's decode this thing. C is for carbamazepine, that's an anti-seizure med. R is for rifampin, a really strong antibiotic. A stands for chronic alcohol use. P is for phenytoin. G, griseofulvin, another P for phenobarbital. And finally, S is for sulfonylureas, which are a type of diabetes drug. All of these put that factory line into serious overdrive. Okay, so if something's hit the gas, it only makes sense that other things would slam on the brakes, right? Well, these are the inhibitors, and they cause a completely different kind of chaos in our little factory. Instead of speeding everything up, inhibitors basically jam the machinery. The conveyor belt slows to a crawl, and the drug isn't getting processed like it should. So it starts to build up and build up until the drug levels in your body can become dangerously high. And yep, you probably guessed it, there's another secret code for this crew. To remember all the substances that hit the brakes, we use the mnemonic G PACMAN. Let's break this one down. That very first letter, G, is for grapefruit juice. There it is, that's the solution to our original puzzle. It gets all the attention simply because it's so common, right? People have it for breakfast, often right when they're taking their morning pills. But the list keeps going. P is for protease inhibitors, used for HIV. A is for Azole antifungals. C for cimetidine. M for macrolide antibiotics. A for amiodarone, a heart rhythm drug. And N for certain non-DHP calcium channel blockers. So, we've met the accelerators and the brakes. But what does this all actually mean for you as the patient? This is the clinical bottom line. This is where all that internal factory drama has serious, real-world consequences. It really boils down to this. With the accelerators, the inducers, the drug level drops, and you risk the treatment just failing completely. With the brakes, the inhibitors, the drug level rises, and you risk serious, even life-threatening toxicity. They are two sides of the exact same dangerous coin. So for example, if you're taking an inducer, like carbamazepine, it could actually make your oral contraceptives ineffective. It could reduce the effect of a blood thinner like warfarin or even antipsychotic meds, which could lead to a relapse of symptoms. The treatment just fails. Now on the flip side, if you have a glass of grapefruit juice, our famous inhibitor, while taking certain statins for cholesterol, the drug levels can literally skyrocket, and that increases the risk of severe muscle damage. And hey, look who's back, warfarin is here again. An inhibitor can make it too effective, leading to a really dangerous risk of bleeding. Okay, I know that was a lot of information, so let's just pull it all together and go over the pharmacist's secret code one last time. Here's the cheat sheet. It all comes down to this. Inducers, remembered by CRAPGPS, speed things up, drop drug levels, and can cause treatment failure. Inhibitors, remembered by G PACMAN, slow things down, raise drug levels, and risk toxicity. You know, at the end of the day, these codes aren't just clever tricks for pharmacists. They point to a much bigger idea. Your body is an incredibly complex chemical environment, and everything you put into it matters. And that's why the most powerful tool you have isn't in a pill bottle, it's communication. So the next time you pick up a prescription, don't just glance at the pills. Look at the warnings, remember that little factory working away in your liver, and talk to your pharmacist. Because really, every medicine cabinet is a chemistry set. The real question is, do you know what's reacting? Thanks for joining us.